Hi, and welcome to mini session number 2, body cavities and organs. Sorry about using this. It's a little bit better than Microsoft because then you'd have to log in and use your Microsoft account, and we'll just put it on YouTube, blah, 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 blah. So let me go ahead and share the outline with you. We're going to go over the intraperitoneal organs. Intra means within. The retroperitoneal organs, and retro means behind, and the infraperitoneal organs, which infra means below. We're going to go over a couple of definitions: peritoneum, mesentery, omentum, mesocolon, peritoneal cavity, serous fluid, and visceral. All right, and there is your outline, and that will be on Canvas. So let me show you the PowerPoint. Outline. Intraperitoneal organs. We have the liver, the gallbladder, the spleen, the stomach, the jejunum, ileum, cecum, the transverse colon, and the sigmoid colon. So everything that is here shaded in purple, it is pretty much all the anterior organs are in the intraperitoneal cavity. Let's go down to retroperitoneal organs, which are the kidneys, the ureters, the adrenal or the suprarenal glands, the pancreas, the C loop of the duodenum, the ascending and descending colon, upper rectum, and the major abdominal blood vessels. So here is everything that's retroperitoneal. It's everything that is behind. It's the most posterior of the abdominal organs. That's why it's called retro. Everything that is colored in blue here is towards the backside. So the infra with an F, infraperitoneal organs is the lower rectum, the urinary bladder, and both the female and male reproductive organs. And this is best seen right here. The bladder is within the pelvic cavity. It has the lower rectum. And of course, your female and male reproductive organs would be here. Still recording. Oh, good. It keeps going off, and I don't know why, so I keep checking it. Super sorry. So let's get to the definitions. Peritoneum. The peritoneum folds large folds that bind the abdominal organs to each other and to the walls of the abdomen. And I'll show you a picture here in just a minute that makes a little bit more sense. So the peritoneum, there's two types, the parietal and the visceral. Okay. The two-layered peritoneum that adheres to the abdominal cavity wall is the parietal peritoneum. The portion that covers an organ is the visceral peritoneum. And the space or cavity between the parietal and visceral portions is called the peritoneal cavity. So most of the structures and organs are covered in sacs. And these sacs create serous fluid, which help decrease the friction between, say, your lungs breathing and your heart beating. And that fluid that's created is called serous fluid. So here's a picture that will help better identify what we're talking about. Just making sure. So here's the parietal peritoneum. Okay, it is attached to the entire abdominal wall, goes around the organs right here. The space in between it is the peritoneal cavity. So this is a double folded mesentery, meaning the inside will always touch be with the inside, and the outside will never touch the inside. Let me explain that a little bit better. So the visceral peritoneum means that there is a sac, and this right here is a kidney. So this is a sac. It's like if you put a pickle in a Ziploc bag. The pickle is the kidney, the Ziploc bag is the visceral peritoneum. Now you put that bag into a gallon-sized Ziploc bag. Then you have just put it into the peritoneal cavity. The kidney doesn't actually touch the cavity, but there is a potential space for if your Ziploc bag broke or if it busted open with air, there is a potential space there. So mesentery is the double fold of peritoneum that extends anteriorly. This is great. Anteriorly from the posterior abdominal wall, so the wall in the back, to completely envelop a loop of small bowel. It is the specific term for a double fold of peritoneum that loosely connects the small intestine to the backside of the abdomen. So here's a close-up of it. And like I said, this inside right here is the cavity. Itself is called mesentery. Just checking. Okay. All right. So the omentum, and there is an OM in stomach. The omentum refers to a specific type of double-folded peritoneum that extends from the stomach, strictly the stomach, to another organ. The lesser omentum extends from the stomach to the liver, and the greater omentum connects the stomach to the transverse colon. This is called the fatty apron. So when you have abdominal surgery, they cut through your skin, they cut through all the layers and the muscles. You will eventually get to this layer of fat, and it is simply called the greater omentum. You can actually flip it up, crazy, I know, and see the transverse colon underneath. This layer of fat just flips over. It's crazy. So that is what is known as the fatty apron, the greater omentum. And omentum connects with the stomach. So the transverse mesocolon is just the name for this part up underneath here. And if you see the words transverse, this is the transverse colon, colon, colon. Meso means middle. It's the middle of the transverse mesocolon. It attaches to the posterior abdominal wall. Okay, and that is it for number 2. Go ahead and do the PowerPoints and try your quiz. Let me go back over here. All right, see you on the next one.